Hello everyone, and welcome to another segment of the East Brunswick Advisory Health Council's Wellness Spotlight. For years, you've heard me introduce this program as the East Brunswick Advisory Health Council's Wellness Spotlight. Many people in East Brunswick don't even know that we have an Advisory Health Council, or how its terrific volunteer members serve the community. So on this segment of Wellness Spotlight, permit me a little nepotism. For the first time in the history of Wellness Spotlight, the spotlight is on the Advisory Health Council. I'll begin by providing you with a brief history of the Advisory Health Council, its structure and purpose, and conclude by introducing you to many of the dedicated volunteers who've shared their time and expertise for the betterment of our community. The East Brunswick Advisory Health Council was established in 1980. It's an agency which makes recommendations to the mayor, township council, and the Middlesex County Health Department concerning health-related matters that support the best interests of the citizens of East Brunswick. It's comprised of up to 13 citizens who are appointed by the mayor and ratified by our town council. The Advisory Health Council members' 3-year terms are staggered. One of the Advisory Health Council members is a township employee who is designated as the township liaison. The Advisory Health Council meets quarterly. Since East Brunswick's public health services are provided by the Middlesex County Health Department, 2 of their health officers are assigned to our town. One of them is responsible to attend each meeting. They provide the Advisory Health Council with monthly health and inspection reports on our town's restaurants, gyms, and their investigation into our residents' concerns. The Advisory Health Council promotes health literacy through this award-winning television program, Wellness Spotlight, and is proactive in supporting the Mayor's Wellness Campaign, which is in development. The current members of the Advisory Health Council are Sandy Katarzi, the Township Liaison from Parks and Recreation, Harriet Golub, Vice President, Karen Scott, Dr. Huzifa Shakir, Roberta Diakil, Dawn Hadlin, Dr. Wilbur Pan, Erin Gilbert, Dr. Tracy Zvin Tutela, Dr. Elizabeth McSpirit, Dr. Joshua Bershad, Dr. Stephen Richards, and myself, Dr. Ken Friedman. Many of these terrific people who serve our town and you are with me today. I'm very proud to work with them. In no special order, I'd love to introduce them to you. And joining me now is Dr. Stephen Richards. Steve, welcome to the Wellness Spotlight.
Great, thanks for having me.
So, introduce yourself to the community, Steve. I know you've been living in town for quite a while. How many years?
I've been in town since 1999, so almost 20 years. When I moved from New York after my residency in the Bronx, my first job was in New Brunswick, and East Brunswick was a great town that people that I knew from New York said, you got to move here.
And how long have you been serving on the Advisory Health Council?
It's going on 10 years now.
Goes fast, right?
Goes very fast.
I know. What's your area of expertise for the people who don't know you?
So I'm a urologist dealing in just general urology. My practice is in Monroe after I moved from New Brunswick.
Tell us about your experience on the council.
It's always been a pleasant one, helping advise the mayor with regards to health issues in town, whether it's fluoride or vaccinations or whatnot, and also with the health fair that occurs every year.
What would you say would be some of the top concerns that people should have about health and wellness these days?
So locally, health concerns are pollution, garbage, also always flu season and vaccinations is a big concern, especially for the elderly, and just quality of life in East Brunswick.
Steve, you've been a volunteer on the Advisory Health Council for about 10 years. Are there any other areas in town where you volunteer?
In town, I do volunteer for fast break basketball, which has been a big part of both of my sons growing up. It's a great organization, including its buddy ball extension. I volunteer at the Medical Society on the county as well as the state level, and all these jobs are volunteer, but it's very satisfying to see, the fruits of your volunteerism coming out.
Well, I want to thank you for all your valued contributions that you've provided the Advisory Health Council, sharing your time and your expertise with us and with the community.
My pleasure.
We appreciate you.
Great. Thank you.
Thank you. And joining me now is Dr. Wilbur Pan. Wilbur, welcome to the Wellness Spotlight.
Hey, Ken. Nice to be here.
Wilbur, tell us, what's your area of specialty?
Okay. So I'm a pediatric oncologist. I've actually worked at Robert Wood for 17 years now, taking care of patients, doing a lot of teaching at the medical school and for the residency program. And currently, though, I'm actually working at a pharmaceutical company doing clinical trial development.
Wonderful.
Yeah. And that just started recently.
Congratulations.
Thanks.
Best wishes.
Thanks.
How long have you been serving on the Advisory Health Council?
Let's see, I was asked to join the Advisory Health Council at the end of 2016, and I officially started at the beginning of 2017. And it's been a great experience so far.
Can you share your impressions of what you thought it was going to be like compared to what we're really doing?
Yeah. The thing that I was most surprised with it was how much of a functional body it is for the town in terms of the reports on restaurants and gyms and whatnot in the area. But most of it has been pretty much what I expected. A lot of focus on things that we can do to encourage wellness in the town. Because being a pediatrician, I'm very aware of the issues that kids have in terms of their health. And one of the things that is one of the most rewarding things in pediatrics is if you can make an intervention in a kid's health when they're young, then that pays off many times over as they get older. So.
And it's great to live in a town like East Brunswick because, as you're very well aware, we put such a high value on our children, as you could see in the school systems here and a lot of the other programs that help support children and good health. What would you say, as a pediatric oncologist, would be some of the top concerns facing children today? Why
don't I speak as a pediatrician? Mainly because pediatric oncology is such a small specialty in terms of the number of and types of patients that we see. I'd like to speak a little bit more broadly about that. So, in general, one of the biggest concerns that I have in terms of pediatrics overall is the overall physical state of kids these days in terms of the amount of activity that they get. One of the things that is, I'm sure you're aware, kids just don't go running around outside like we used to. And when we were kids, I remember getting home, dumping off my stuff, and then taking off with my friends and not coming back until dinner time. And for many reasons, that has changed. But one of the downsides of that is that kids don't get as much as activity as they used to, and obesity and weight issues has become a big problem. Globally, things like type 2 diabetes, which used to be an adult disease, is now showing up in children. There's certainly long-term health problems that happen because of being overweight as a young child that leads to that leads to not so great health habits as you become older. The complications that you have from such a thing show up earlier. And just rotating back to my specialty, cancer care for kids is tough enough, but if you pile on a weight issue that you have to deal with a child, that actually has implications.
And a sugar metabolic issue, which has such broad negative effects throughout the body,
right,
for the short and long term.
Yep.
So, as a specialist in this field, what kinds of things would you like to see our township do that we are not doing yet?
First of all, I actually want to state that from my kids' experience in the school system here, I've been really impressed with how much nutritional and health information overall is disseminated to the kids, because my boys, when they were younger and even now, they're still telling me that I'm not doing things right when they catch me not eating my veggies or whatever. From a town standpoint, I think I have a hard time thinking of anything more that we could do, but I would say that maintaining such a high level of activity in this realm for the kids is probably the toughest thing. As time goes on, resources become tighter, and it becomes easy to jettison things that people might see as not being that important. And unfortunately, things like health education tend to be one of the first things to go if that becomes an issue.
So the big thing is getting the kids off the couch,
Yeah.
putting down the video games and getting them outside.
That too. Yeah.
And away from the refrigerator.
Right, right.
Well, we're just about out of time. But Wilbur, I want to thank you for the contributions that you've made to the Advisory Health Council. You always impart your wisdom and your valued comments, and we appreciate it.
Yeah. Well, thanks. I'm just happy to be of service.
Thank you for being on Wellness Spotlight.
Okay, great. Thanks.
And now, everyone, I'd like you to meet Dawn Hadland. Dawn, welcome to the Wellness Spotlight.
Thank you, Ken.
Dawn, I'm sure many people in town know you. You grew up in East Brunswick, didn't you?
Yes, I did.
So for the people who haven't met you yet, why don't you tell everybody a little bit about you and your background?
Well, I'm a registered nurse. I graduated in 1991. I worked at Robert Wood Johnson for several years, and then I was actually disabled for several years, and now I work at Maxim Healthcare Services doing home care. I'm a clinical supervisor for home care.
Now, before you became involved in home care, did you have a specialty in nursing, or was
I worked in, it was med-surg, but it was trauma, vascular, and general surgery. I loved it, absolutely loved it.
So growing up in East Brunswick and being deeply engaged in the culture here, what was it that attracted you to the Advisory Health Council besides being a nurse?
Well, it was because I was a nurse and also because I was disabled, so I kind of saw both sides. I was almost like a professional patient.
So in the 11 years you've been serving on the council, what have been some of the highlights for you?
Probably like sitting at the tables at the events and stuff like that, and meeting people. That's basically, what I end up doing is sitting at tables.
At East Brunswick Day.
Yeah, at East Brunswick Day, and there was Healthy, Wealthy, and Wise was one of them. Then there was the one at the mall, which
Right.
might have also been East Brunswick Day.
Years ago, right.
Yeah, it was many years ago.
What do you see as some of the biggest concerns that our town should have about health and wellness, Dawn?
Well, there's, a big issue that's still not resolved is the fluoride issue. And every time I'm at my dentist, we talk about it because, I had no idea that it was a product of the fertilizer industry. I thought it was pharmaceutical grade. And I'm so blown away that that's what it is. So it needs to, obviously, hopefully we'll get it out of there. But also, there was the Mayor's Wellness campaign that's being developed and
That's right.
stuff like that. Which,
yes, and good things will be coming down the pipeline soon with that.
Yeah.
Good. And, as far as your role within the town now, do you volunteer in any other areas?
No, the only thing I volunteer with is I actually volunteer with, I go to a headache center in Philadelphia, and it's Jefferson, and I'm in their health mentor program. And so I work with a group of students, like 2 times a year.
From the things that you've learned being a nurse, what things would you like to share with the public that's watching you now, as far as health and wellness concerns go? What areas do you feel people can improve the most?
Probably diet and exercise, probably.
I know that according to the Middlesex County Health Department and a lot of the hospitals in the area, when it comes to health literacy, some of the most important concerns have to do with heart disease,
Yes.
sugar metabolic issues, diabetes,
Cholesterol.
and cholesterol, and diet, obviously, obesity. We're very involved in providing the mayor, town council, and the health department with our recommendations on different aspects of health and health-related issues. What advice would you share with the residents of town on things they could do to be healthier?
I think for me, being a volunteer on the Advisory Health Council has been a wonderful experience. And I think it really helps you get out and socialize more. And a lot of people need that. People are kind of shut in, they're playing with technology and things like that. There are so many volunteer organizations in East Brunswick.
Our member, Dr. Wilbur Pan, was on earlier. and he was talking about the importance of getting kids off the couch and getting out and exercising.
Yes.
And it's true, you're right. When you're out and you're among other people and you're working towards a positive common goal, it really feels good, and it's good for you.
Yeah.
And it's a stress reliever too. So I want to thank you for the years of service that you've provided and you'll continue to serve, Dawn.
Yes,
and
I
I
will.
want to thank you for the positive contributions that you make to each meeting.
Thank you.
Thank you for being on Wellness Spotlight.
Thank you for having me.
Welcome. And joining me now is Dr. Huzaifa Shakir.
Hi, Ken.
Dr. Shakir, welcome to the Wellness Spotlight.
Thank you. Thank you for having me. Appreciate it.
And welcome to the Advisory Health Council. You're a relatively new member.
Yes, I am.
Before we talk a little bit more about East Brunswick and some of the things that you'd like to see us do, begin with your background and experience.
Sure. Born and raised here in New Jersey, something I'm really proud of. Born not too far from here in New Brunswick, and I did my training here in New Brunswick in cardiothoracic surgery. So I'm a native of the area. We've lived in East Brunswick for about 15 years, and we absolutely love the town. Moved here for a lot of great reasons. I practiced heart and lung surgery up in northern New Jersey, and a couple of years ago I met with Dr. Brad Cohen, our honorable mayor here in East Brunswick, and he recommended me to this council, and I was honored to serve, and I'm looking forward to a couple of years of service with you, and looking forward to that.
As a cardiothoracic surgeon, what do you feel are some of the most pressing health issues that face residents of Middlesex County, in particular the residents of East Brunswick?
Well, I think, as a cardiothoracic surgeon, I see frequently, disease at its end stage, but I think, it's getting to prevent that is the more important thing. So particularly in this area, we're faced with a lot of, stress, commuting, getting to the city and jobs and the rat race, so forth. And it's a wonderful town, and I think it's important to preserve in our town some sort of peace of mind so that we can sort of de-stress or unwind when we get home. So I think I see my role on the health committee as to try and make sure that we have a safe home and a healthy home so that it leads us to prevention and not get the heart and lung disease that I see so often at work.
Those are very good points. What suggestions would you have for people to focus on to have a safer and healthier home?
I think, understanding our environment and understanding how we contribute to it is very important. Recently the community I belong to undertook an initiative to plant trees. And I think that was just in itself, the activity was very peaceful and very, stress relieving. And I think something like that is important in our community. I think as a health committee, we sometimes overlook the small things, the green grass and the birds on the trees type of thing. But I think just as neighbors, I think if we can honk a little less and, take turns yielding on Riders Lane, I think we'll be, in the ER a lot less.
It's too bad we can't always hit the green lights.
Right.
What are some of the things that you do to help deal with stress when you hit the red lights in your life?
Yeah. Well, you got to practice what you preach, right? So lucky to have XM radio and AM, FM. But I think it's just important to take stock of what we're doing and be calm. I think developing community outreach is important because it makes us less lonely when we come home. And I think it's important to have good neighbors, good friends. And I think that's one of the more important things that I see in a person's life when you're faced with heart disease or lung cancer or something like that.
This is very refreshing because for a person who's very immersed within the field of medicine and surgery, the key things that you're speaking about are really relationship building and being out with nature.
Right.
It's a very different posture that a lot of medical physicians take.
Right.
What was it that made you, come to this realization?
Well, as a heart and lung surgeon, you see life at its, most delicate moments, and you really get to reflect on what's more important. My father had bypass surgery 4 years ago. We rushed him to Robert Wood for an MI in the middle of the night. So I got to see firsthand as a patient and as a relative what it's all about. You mentioned posture. As a chiropractor, I'm sure you understand the importance of maintaining well-being and of not letting the rat race sort of get ahead of you, and taking care of yourself is the most important thing we can all do for ourselves.
Yes, as a chiropractor, my focus is really improving a person's tolerance to the physical, chemical, and emotional stresses that they're subjected to on a daily basis, because that's what the healthiest people have the greatest capacity to be able to do.
Agreed. Yeah.
You know, and we do that by removing interferences to energy.
Fantastic.
What would you say would be some of the things our community could focus more on to help improve wellness within our town?
That's a good question. I think, you know, like I said a little earlier, alluded, I think if we can work together to create a town where there's a lot of wellness, community outreach, just improving green spaces, for example. You know, recently you introduced an initiative to talk about our healthy water supply, and I think as a community, if we all weigh in as members of the community, it impacts us all as neighbors and friends and family.
And you'll be pleased to know that pretty soon we're going to be having a Walk with the Mayor
Excellent.
event, and Mayor Cohen has agreed to do the first one.
Fantastic.
So everybody should stay tuned and learn more about that, so you could turn out and support this great event, and if it goes well, we'll have more of them.
Looking forward to it.
I just wanted to say thank you so much,
Appreciate it.
not only for volunteering, but also for sharing your wisdom with the township and helping to make our community a healthier place in which to live. It's always a pleasure having your valued comments at our meetings.
Thank you. It's an honor to serve, and I appreciate the recommendation from the mayor to serve on the committee. Thanks
Thank you,
again.
Dr. Shakir.
Thank you.
And now, everyone, I'd like to introduce you to the Vice President of the East Brunswick Advisory Health Council, Harriet Golub. Harriet, welcome to the Wellness Spotlight.
Thank you, Ken. I'm happy to be here.
Harriet, a lot of people know you. You've been a longtime resident of East Brunswick, but for the people who haven't met you yet or don't know you, can you tell us a little bit about yourself?
Well, we've been a resident here for 45 years. Our two children went all through the East Brunswick school system. My daughter and granddaughter still live here, and we're not moving. It's a good town. It's a good place to be.
You're a volunteer, Harriet. You're always there to help someone. You're always there to lend a hand. And yet volunteerism is down these days. Why do you think that is?
Well, I have different theories on volunteerism. When I first moved to East Brunswick, there weren't very many families who were working, dual income families. It's very hard to volunteer when two people in the family are working. And then there's children, and there's music, and there's soccer, and there's whatever else. And I think that in people's hearts, they would love to volunteer, but there's a time constraint going on, and that's a pity.
Talk a little bit about Reiki and your background in it, and why you feel you can offer help and advice to the Advisory Health Council that would positively impact the health of East Brunswick.
Okay, well, Reiki deals with universal energy that we all have. Sometimes you wake up and you say, oh, I don't have much energy, or sometimes you wake up and say, I'm full of energy. And that's how I define energy. There are many reasons where wellness goes along with positive energy. Take Norman Cousins, who was diagnosed with a rare form of cancer. They told him to go home and pack his things, and he decided he wasn't going to do that. He was going to put laughter into his life, positive energy, and he lived for another, I think it's 26 years. So with this, you asked about volunteerism, and I told you about the hectic pace that we're living in. And even though I'm a volunteer, everything is so fast today, and it's fast. And if the way I cope with it is take a moment out just to breathe. We forget to breathe sometimes, and that's helpful. It helps me to keep positive energy, to check in with myself every so often. How am I doing? How am I doing physically? How am I doing emotionally? How am I doing spiritually? We all have choices. We could decide to whine and be a victim, or we could decide to embrace the day. And if you want to embrace the day and live in gratitude, you try not to be sick, and those thoughts don't come over you.
That's a very big distinction that I'm glad you're making, because you know, we live in very challenging times. There's lots of change that's going on, and it's not so much what happens to you, but how you choose to react to what's happening to you, and there you're in complete control of what's going on. What tips do you feel you could share to be able to help the viewers to stay positively minded, even in the face of such negativity or things that may not be going well at the time?
Well, I'll give you a little secret that I learned many years ago from Thich Nhat Hanh, who's a Vietnamese monk. And I did a workshop with him, and he said, live in gratitude. Be thankful, say thank you for something in the morning and thank you for something at night. It doesn't have to be big. It could be the color of this cup, the blue color of the cup. And when I'm so focused and wondering what I'm going to be grateful for, the negativity goes away. So that's how I cope. That's my mechanism.
You know, I've heard that too, that the two most important emotions that people have are love and gratitude.
Mm-hmm. Yeah.
You know, you've seen so many changes that have taken place in our town over the years that you've lived here, Harriet. I guess when you first moved in, it was more of an agrarian type of community, you know, a lot of farms. One-lane roads, not too many traffic lights, and now look what's going on.
You make me sound like I came here 100 years ago.
Where's your coveralls and pitchfork?
Yeah. But you know what I'm so happy about? You talk about energy and wellness. What the mayor is doing now on Route 18 just brings wellness, will bring wellness to the people who go up and down Route 18, to get rid of all the blight, to move into planned communities, to take care of the empty buildings. And once people get off the turnpike and go down Route 18 and see what Mayor Cohn is trying to do and will accomplish, it'll make the whole township feel better.
You know what? I agree. We're going from retraction to attraction, and I think that's going to be very powerful for our whole community. And I think the resources that it will bring and the state of mind that it will bring will be a very positive thing.
Yeah, it's the state of mind. I like what you said. Mm-hmm.
What were some of the best wellness lessons that you've learned in your life that you could share up to this point, Harriet?
It's mainly a thought process that I have to live mindfully and live in the moment. That the past, for me and my belief system, is all perception, and you can't tell what the future is. So if I'm sitting here talking to you, I'm sitting here talking to you. You know, if I go out after, I go out afterwards, and that has helped me stay focused. I also believe in energetic healing. I try not to take meds. I feel that I can heal myself in many ways, and that keeps me positive too. So.
Harriet, I want to thank you so much for your years of service to the Advisory Health Council, for serving as Vice President, a heartbeat away from the presidency.
That's right.
But especially for your insights and for all the great things that you share to help support higher levels of wellness in East Brunswick. Thank you.
It's my pleasure.
Everyone, now I'd love for you to meet Sandy Katarzi, our township's liaison to the Advisory Health Council. Sandy, welcome to the Wellness Spotlight.
Thank you, Ken.
You know, I feel that you're the person that oils all the wheels and shovels the coal that makes our train go, you know, for the Advisory Health Council. Tell the viewers a little bit about your background and experience working for the township, what department you're in, what you do. You know, you do so much. And then we'll talk a little bit about what you do for the Advisory Health Council.
Okay. I joined the township in 2005, and my first job was with the day camp. I was day camp secretary. And that was a very busy job with planning all the trips for the campers and whatever else went along with that. Then I moved on in 2012 to the position I am in now, and I am a program coordinator for Recreation Parks and Community Services. And that job entails a lot of detail. We have many events, and I help plan them and orchestrate them as well as I also handle all the community service needs. We have a modest food pantry that we keep in the township, and I am responsible for that. I also run a food basket program during the holidays for our township families. What else do I do?
You brushed over some of the events that you help to coordinate, and people don't realize how big these things are. What are the events that you do, Sandy?
Well, we have 3 big events going on. First one is the Fine Arts Festival. It also has a new name this year. We're calling it the Art and Music Festival. That will be on June 2nd. That is with the Fine Arts Festival with the artists and crafters. Then we'll also have music as well as food trucks. The next big event after that is July 4th, which is our July 4th celebration along with the fireworks. And then our third big event is East Brunswick Day. That is something, this is I think our 4th year doing that. And that is another big event to be held this year on a Sunday, September 23rd. And in between all those events, we have other events. We have Memorial Day, we have children's concerts, adult concerts, children's movies in the park, Veterans Day, so all those events get planned along the way.
And the Director of Recreation, Parks, and Community Services is Mike Reisner.
Right.
And I just have to say that I think that all of you do such a wonderful job for our community.
Thank you.
Now, if that's not enough, how did you get shanghaied into helping the Advisory Health Council?
Well, that comes under my community services, I believe, and so that is how I came about joining the Advisory Health Council as the liaison secretary.
And how many years have you been doing that?
Since 2012, so this is my 6th year. Yeah, time flies.
Is this the only board that you serve, or do you also work with other organizations?
No, this is the only one that I'm serving on.
Talk a little bit about your responsibilities with the Advisory Health Council and what you do for us.
Well, I take care of the minutes and the agendas for the meetings. I help send any letters that you request, as well as any information that we might have to gather for our meetings, or guest speakers. We have some guest speakers coming to our meetings. That's, about what we do. Anything that you request of me, I'm there to serve.
As the township's liaison and observing things from your perspective, what would be some of the biggest distinctions that you've made?
Well, with the members of the council, and we have had past members, new members, and they are all different fields. And in the medical fields, I'll say, or something to do with medicine. And it's very interesting to have their opinions come to our meetings and their ideas. And I think they respect each other's opinions and thoughts, and I think that is what makes a great committee. And bringing that all together allows us to do great things or come up with great ideas for the mayor.
Well, we couldn't do what we do without you, Sandy, and I'm very happy to be able to introduce you, working so diligently behind the scenes.
Thank you.
And I know you shy away from that kind of recognition, but I think it's also important for people who go the extra mile to be recognized by their community, because you work so hard to help us in so many different ways. So I just want to thank you once again for your years of service, Sandy, and I look forward to working with you many years into the future.
Yeah, thank you. It's my pleasure.
Thanks for being on Wellness Spotlight.
Thank you.
And now I'd like to welcome Erin Gilbert to the Wellness Spotlight. Thank you for joining us today, Erin.
Thank you for inviting me, Ken.
And thank you for being on the Advisory Health Council.
It's my pleasure, seriously.
Tell everyone that's watching about your background and experience.
Well, I grew up in East Brunswick. I went through the school system here from K through 12, and I really wanted to give back to my community in some way. So when I went to school, I went away for school, and when I came back, I actually started working at a pharmaceutical company in Princeton. And then at the same time, I started going to Rutgers to obtain my master's in public health and health systems and policy. And from that, I wondered how I could get involved in my community and what else I could do to just keep the spirit of public health alive in what I was doing and in my town.
What are some of the latest trends in public health these days?
Well, obviously, a lot of it is on cardiovascular health, smoking, vaping. I mean, there's a lot of concerns with young children or with kids in general. There's this push where a lot of kids stopped smoking, but then they started vaping, and now we see vape shops popping up all over the country, honestly, and especially in New Jersey. And I think that's a big concern. Also, texting and driving. Like, there's a lot of advances in technology that have actually impacted public health in new ways, and so we're looking at innovative ways to kind of combat this.
As far as East Brunswick is concerned, compared to the rest of the state, how do we place? Have you looked at this at all?
We're pretty good compared to some of the other parts. I mean, there's a lot of environmental concerns up north, like with the Passaic River. Also, you have a lot of the opioid epidemic kind of hitting Camden and Trenton. There's also other issues like low-income patients, low-income vulnerable populations, where they're served by federally qualified health centers. That's more south. So East Brunswick we're a pretty healthy place, but there is still an area for improvement. Diabetes, overweight, obesity, that kind of thing is really something that East Brunswick can look at improving. And I believe that the Advisory Health Council has taken steps to see what we can do to improve that.
Yes, I think some of the biggest concerns within our county would be obviously cardiovascular problems, sugar metabolic issues like diabetes and obesity, but also stress reduction too. What kinds of things are communities doing to help deal with stress? I know there's 3 kinds of stress that most communities have to face: physical stress, chemical stress, and emotional stress.
Sure, of course. I mean, mental health is a huge issue that is not addressed often enough because of the stigma attached to it. And I really think that I do see that people are more open about this, that there is a dialogue started, not just in East Brunswick or New Jersey, but just in general. For example, the opioid epidemic, I wonder where that stems from. And part of the reason that we're hearing more about it is not just that doctors are overprescribing, but that also people are depressed, people are not sure exactly what to turn to. And so it becomes a reliance on a drug to just feel a certain way.
Well, that's it. I think it can probably stem from a culture that's based upon instantaneous gratification and symptom treatment rather than getting to the real root cause of an issue and what we can do to focus on improving the body's capacity to self-heal in a natural way and stay well.
Absolutely, absolutely. I mean, you see that in other examples too, like even just texting or Snapchat, which is what the kids are calling it these days, I've heard. But just where people don't want to wait for results, they want to see instant gratification, and that can lead to like other disastrous results, like texting and driving. That's a big thing. I see that, I see signs all over the place, like you text, you pay, or don't text and drive, put down the phone. But I drive up and down Route 1, and I still see people like on their phones all the time. So I know it's a big, definitely a spectrum, opioid versus texting, but still it's this new culture that we're entering.
Going forward, what do you think some of the biggest pushes are going to be with a lot of the communities in our area? As far as heart health goes, sugar metabolic issues, there are people who don't want to have personal choices that they make in their lives legislated by others. And then there's people who feel that they don't want to be responsible to have to pay through higher insurance premiums and other costs for people who neglect themselves.
Sure. Well, I think people sometimes view these measures as trampling on their basic human rights, which of course I can understand that perspective, and I think everybody on the Advisory Health Council can as well. But people often forget that even something like the seatbelt is one of the biggest public health achievements ever. So I think it's getting used to understanding that it's not trying to take away somebody's right to decide on something. It's more steering them in the right direction.
Erin, we really appreciate having someone with your background and experience on the Advisory Health Council, with an understanding of public health, because that's what it's really all about, and that's why we're here, to be able to help improve the health and wellness of our community. Absolutely. So thank you so much for volunteering and for giving of yourself and sharing your expertise and always sharing such great advice with us at each meeting.
Thank you, Ken. I appreciate it.
Thank you, Erin.
All right.
Everyone, now I'd like to introduce you to Dr. Tracy Zivintutella.
Hi, how are you?
Terrific. Welcome to the Wellness Spotlight. Tracy, tell us how you became involved with the Advisory Health Council.
I was actually asked by our current mayor, Mayor Brad Cohen, and him and I have worked together in the hospital and in the community with patients together, as I'm a physician. And I figured what better way to give back to my community than to be on the Health Advisory Committee.
Tell us a little bit about your specialty and where you work and some of the things that you do.
Sure. I'm an infectious disease specialist. I work out of St. Peter's Hospital. I also am out of Robert Wood Johnson, and I work, my office is in Monroe. As an infectious disease specialist, I do inpatient specialty consults. I do travel medicine for people who like to travel and want to avoid getting sick. And I do wound care as well.
What are some of the most common conditions that you see as an infectious disease specialist?
So depending which hat I'm wearing. So when I'm in the hospital hat, most commonly I'll see, either post-op infections from surgeries or critically ill patients that have come in with skin infections, pneumonia, bacterial blood infections. When I'm in the office, I tend to see things that have kind of stumped primary care doctors or other specialists that they need a little help with identifying, anything from rashes to fevers that nobody can figure out.
What was it that drew you to that specialty?
I had really good mentors when I was training, and infectious disease doctors were the detectives of medicine, and I found that being the detective and working with every specialty in the hospital was just really exciting, and every day was different.
Tell us about your role on the Advisory Health Council as a relatively new member. What were your expectations compared to the reality?
I'm not sure what my expectations were going in. I kind of didn't know too much about it and was pleasantly surprised when I learned of all the different ways we can impact our town. Everything from, trying to get everybody motivated and fit and providing different needs to the community that I didn't even know existed until I was on the council.
With your affiliation at 2 hospitals and with a number of physicians that I'm sure you interact with, what are some of the top health issues and concerns that you see popping up frequently these days?
I would have to say one of the big health issues is obesity. Children, adults, and the unfortunate sequelae of being overweight, whether it comes down to diabetes, infections, wounds, your immune system being down. And so to me, the biggest thing we can give to our community is trying to be a fit community and trying to incorporate better wellness and education and physical activity into our life.
I was just talking with someone the other day about that, how when we were kids and we got out of school, we'd come home, drop off our books, change into our play clothes,
right,
and then we go out and play, and we had to be home by the time the street lights went on.
Yep, absolutely.
That doesn't happen anymore.
No. I think our environment's changed, and for good or bad, and because I have children at this age and I'm always making them go outside and play whether they like it or not, it's good for their bodies, it's good for their minds to go and just be creative and physical, and it's good for them sitting in front of a TV or an iPad or a device of any sort. I think we missed the ball by not encouraging our kids to just be creative with their minds and their bodies.
Are you the first medical physician in your family, or did you come from a family of physicians?
I am the first medical physician in my family. I am married to a man who comes from a long history of physicians, but I am the first in my family.
What would you say are some of the top health habits, good health habits that your parents taught you growing up?
I think some of the good health habits really were just being active. We were always active as a family, and they weren't, I can't say my parents were the most fit, kind of people, but we always were doing things. We were hiking, we were going for walks, we would randomly just play tennis, and we weren't tennis professionals in any way, shape, or form, but we were always doing things, and we were doing things together. And I think that, and incorporated with, my mom worked full time, but we always ate dinner at home. We seldomly ate dinner out, and I try to replicate that for my kids as well.
That's great. East Brunswick has always been a town that has focused on doing more, doing better. We do so many things so well, but we're always reaching a little bit higher. Now that you've joined the Advisory Health Council, in addition to the good work that everybody does for the township and the impact that we're trying to make on public health and wellness, what type of things would you like to see happen around here going forward?
I'll be honest, I think we're making strides with doing, having sponsored events, 5Ks and 10Ks and environmentally friendly types of activities, which I think are all great. I'd like to see better nutrition in the schools. I'd love to see that we can make an effort as a council and as a community to have fresh fruit and a garden in all of our schools and impact our kids and start to change their mind over just having to open a package versus actually eating what's good for us.
I agree. Dr. Tracy Zivintutella, thank you so much for coming on Wellness Spotlight today and showing the community a little bit about who you are and why we're so happy to have you as an asset on the Advisory Health Council.
Thank you for having me.
This concludes another segment of the East Brunswick Advisory Health Council's Wellness Spotlight. On a personal note, I'd like to express my sincere gratitude to Mayors Sinagra, Oskowski, Neary, Stahl, McAvoy, and Cohen for the support they've given me since I was appointed to the Council in 1992. I feel that one of the reasons why we can have pride in our community is due to the high value we place on the quality of life here. I'm honored to have had an opportunity to make a contribution over the 26 years that I've served on the Council. Thank you to the members of the Advisory Health Council, past and present, along with our past township liaisons, Judith Lebline and Karen Keskis. I would also like to thank the East Brunswick Public Library and EBTV, especially Cindy O'Connor, past station manager, who taught me and helped me so much when Wellness Spotlight began, and the present manager, Dave Ambrosi, who carries on her legacy of leading EBTV and his team with the highest degree of broadcasting excellence, integrity, and grace. So on behalf of the Advisory Health Council, I'm Dr. Ken Friedman, President of the Advisory Health Council, reminding you that wellness works when you work it.